Hello everyone, my name is Melanie Pereira, and I will be presenting to you my newsletter on asthma. On the top left-hand corner you will notice, what is asthma? Asthma is a disease that affects your lungs, that causes the lungs and airway to become easily inflamed when exposed to certain triggers. Asthma causes wheezing, breathlessness, chest tightness, coughing at night, or early in the morning. If you have asthma, you have it all the time, but you will have asthma attacks only when something bothers your lungs. I've also listed here a statistic that I found, which is 1 in 10 children had asthma in 2009 in the United States. I've listed in the middle of my newsletter, what are the signs of asthma? The signs of asthma are frequent or intermittent coughing, a wheezing or whistling sound when exhaling, shortness of breath, chest congestion or tightness, chest pain, particularly in younger children, trouble sleeping caused by shortness of breath, coughing, or wheezing. I've also listed here, what is the cause of asthma? At this point, we still do not know the cause of asthma, so there is no direct cause. However, some of these factors are thought to be involved. The factors are inherited traits, some types of airway infections at a very young age, and exposure to environmental factors such as cigarette smoke or other air pollution. On the right-hand side of my newsletter, I've mentioned when to see a doctor. This is useful for parents and teachers, and when you should see a doctor or take your child to see a doctor as soon as you suspect that they have asthma. So if you're reading this newsletter and you suspect that your child has asthma, I would go ahead and make an appointment with the child's doctor physician. The signs that you might notice in order to call the doctor's office are coughing that is constant, intermittent, or seems to be linked to a physical activity. An example of this would be a teacher noticing a child's coughing throughout playing in the playground, or a parent when their child is playing outside. You should also take them to see a doctor if you notice wheezing or whistling sounds when your child exhales. This might be noticed at home, if a parent is noticing their child is wheezing at night when they begin to fall asleep, or when they first wake up in the morning. You should also go to see a doctor if you see any shortness of breath or rapid breathing, or the child complains of chest tightness. On the second page of my newsletter, I have mentioned what kind of testing is done for asthma. So for children who are the age of 3 and younger, who have some symptoms of asthma, the doctor may use a wait-and-see approach. This means that the doctor will often wait until the child is older and still has those symptoms, and will wait to treat the asthma. This is because the long-term effects of asthma medication on the infants and young children still are not clear. In a child who is 6 years of age or older, doctors diagnose asthma with the same tests used to identify the disease in the adults. Lung function tests, a pyrometer, measures how quickly and how much your child can exhale. This test may be performed at rest, after exercising, and after taking asthma medication. And allergy skin testing may also be needed. I've also listed what is the treatment for asthma. When treating asthma, this involves preventing the symptoms and treating an asthma attack in progress. So there are medications such as a long-term relief medication which can be used to help reduce the inflammation in the child's airway, which may lead to the symptoms of asthma. Also, quick relief medications quickly open the swollen airway that is limiting the breathing. Most children with asthma use a combination of long-term control medications and quick relief medications, taken with the handheld inhaler, as this little girl demonstrates in this photo. So how can occupational therapy help? Occupational therapy can benefit a child with asthma by addressing solutions and accommodations for your child, whether it be in the school or at home. Occupational therapy will enable your child to return to their normal activities. With the help of an occupational therapy practitioner, parents and teachers can be taught how to avoid triggers of asthma. Parents and teachers can also learn how to manage the child's asthma and what to do when an attack occurs. Occupational therapy practitioners can help to develop creative ways to ensure that the child is involved in activities. The goal is always to get the child to do what they want to do. I hope you have enjoyed my presentation of my newsletter on asthma.